Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. I want to get right to the show, so I want to first thank my sponsor, PromoLife, promolife.com, PROMOLIFE.com. PromoLife makes the finest ozone products that you can get, possibly literally in the world. Some of the more important products, particularly relating to our show, are the dental products that they make. They make a medical ozone dental generator that can be used in many different ways. Ozone in dentistry is very old. Book written by Dr. E.A. Fish, a German dentist, wrote a book on called Ozone in Dentistry. Back in 1931, it was published. So ozone plays a very important part in having a healthy mouth, and they make dental products like organic ozonated oils that you can use for oil pulling, if you know about that, and also for brushing the oils into your gum, or even now using what I use, the organic ozonated glycerin that they make, ultra pure. And you brush that into your gums after you brush, you floss, and do everything else normally. You brush that in and you don't spit it out, you keep it in. So contact PromoLife at 888-742-3404. That's 888-742-3404. Tell them I sent you you heard about it on the show. They'll do something special for you in terms of a percentage off or something like that. My second sponsor is doctorsbiome.com. DOCTORSBIOME. Sounds like biome, but it's biome.com. Doctorsbiome.com. They make an amazing organic ozonated beverage, I guess you would call it. Um, all the 15 living patented strains. That's what makes it stand out. Eventually, all probiotic companies are going to try to find a way to make a living probiotic. Once you've freeze dried it into a capsule, powder, or tablet form, much of it has been destroyed because the bacteria are very sensitive. And they don't necessarily come back to life when you drink them with water and swallow into your stomach. Then, if they do, they have to grow into adults to do any good at all. And by the time they reach the gut, there just isn't enough time to do it. Unfortunately, there have been plenty of studies published on why probiotics have some benefits, but minimal benefits. Doctors Biome has been publishing showing amazing benefits against many different medical problems because the gut connects to everything. It's called the gut organ axis. Look that up if you have any kind of medical problem. Look up the gut heart axis, diabetes axis, weight loss axis, on and on and on, and you'll find why you're having a problem that Doctors Biome may overcome. And they make a medical food version of it. So they're allowed to actually make medical claims on a medical food that you can't make on a food supplement. It's not an inexpensive product, as you're going to learn. Nothing good is cheap and nothing cheap is good. But if you use my coupon code that I give now on the air which I only have used for my patients, Howard35, you'll get 10% off the retail price of the product, which is a wonderful way to get started. So go to doctorsbiome.com. So today, we have back, although this may be the first time you're listening to the show, Dr. Greg Vigoren from Newport Beach, California. He's up real early, and we're going to be talking about today how dentistry is necessary to prolong your life. If you don't have a healthy mouth, your life is going to be significantly shortened. Prevention is the key to everything. That's what this show is about. Prevention and then healthy ways of fixing the problems. So without further ado, hello, Dr. Vigoren. Welcome. Good morning.
Good morning, Howard.
Let's
We'll get right into it.
Right into things. Yep.
In the first session, I talked about how sleep and sleep fragmentation and oxygenation when you sleep can shorten your life by anywhere from 2 to 5 decades. In this section, I want to talk about oral bacteria and viruses and how they enter the body and how this whole uh, rigmarole gets started. And so I'm going to do it in two segments. This will be one, and we'll do another one on once you get the disease, how do you treat it? And this one is how do you prevent getting the disease? So you have to understand that dental oral disease caused by pathogens, by germs, by bugs, by bad organisms, is a contagious disease. It's passed on from generation to generation. You cannot be born with it because it takes a hard surface, the tooth, and most children aren't born with teeth. And so it's transmitted. So number one, you have to understand it's a transmitted uh, disease. It's uh, uh, you get it from your parents or your grandparents or your siblings, right? That's number one. Number two, all back teeth and some front teeth up on top have got developmental holes and cracks in them. It's a predictable, understandable defect in the hard castle walls, is what I call the enamel. The enamel is made out of granite and it's a big castle, but these holes and cracks called pits and fissures are like the castle never got the doors and the windows put on. And so when the hordes come, they don't go through the castle walls, they go through the doors and the windows. And once they get inside the tooth, the dentin or the inside of the tooth is like a Hostess Twinkie. It's like a 24-hour buffet. All right. And the bugs that get into those holes and cracks, they can stay in a tooth for the next 80 years. And every time you brush your teeth, they go, are you doing that damn thing again? And, or she, and then as soon as the toothbrush comes out of your mouth, they repopulate or reseed the entire oral cavity with bacteria that destroy the teeth. So if that's what happens through the use of magnification and high resolution photography and high resolution display, we can actually show people these holes and cracks at 18x, just putting it up on the screen. And I can go, when I lecture, I can put it up to on a 40-foot screen to 2400 power. Well, most dentists have never seen this at high resolution. But when a patient sees this at high resolution, the biggest argument I have, especially with mothers, is no, I'm not going to do every single one of them today. I'm not traumatizing your child because you have anxiety now that you know something that you didn't know earlier. So with these holes and these cracks, under high magnification, which allows you much higher motor skill control, you open these cracks up and they're already open, but you open them larger, you clean out the bacteria and you seal them. It is the most valuable procedure I do in dentistry. And for some reason, dentistry waits until there are great big potholes or sinkholes and houses fall in them instead of addressing them before they cause a lifetime of disease. All right. So filling these cracks and holes or pits and fissures is one of the most valuable procedures I do. And I've got patients that I treated 45 years ago or longer now, 50 years ago, that I see not only their children, but their grandchildren. And that pool of patients has 95 to 98% less dental disease over a lifetime. Well, that's enough savings to take your family to Hawaii on 10 vacations per child.
Mhm.
Okay. And so early intervention on these holes and these cracks is number one intervention that I can do. The other intervention is educational. And I said this is a contagious it's a contagious disease that you that you most generally get transmitted from parents or grandparents or siblings. If you teach a small child to clean their teeth properly when they're little, they will do it the rest of their life. They establish a neural pattern that won't allow them not to do it. Okay. And I learned this from one of my patients who told me she brushed her dog's teeth every day. Okay. And it made me think about this. The children's book for mothers and grandmothers is Teach Your Dog to Floss. And the first line on the first page is you can't teach a dog to floss, silly. But if you brush their teeth from the time they're puppies, they will pout if you don't brush their teeth every day because it's a bonding experience and it's a neural pattern that's established young. So if you and the flaw in this is if the parents don't know how to adequately clean their teeth. Illiterate parents can't teach early reading skills. But if the parent knows how to evaluate and how to clean, and that's just simple, uh, very simple to do and very easy to understand. Instead of punishing the child, brush your teeth and go to bed. The adults get to stay up later. If you change the verbiage and the communication to, if you get ready for bed, we'll brush our teeth together and read a book. And now you get a little stool and a little toothbrush and a big toothbrush. And you brush your teeth at the sink and they brush their teeth at the sink. And then they check your teeth with your toothbrush. And then you check their teeth with their toothbrush. In a year or two, that child will reduce, just like filling the holes in teeth, the cracks in the holes, the pits and the fissures. That alone will reduce dental disease by 90 to 95% over a lifetime. And so the educational part of this is very powerful. But as I said, if the parents or the grandparents don't know that it's communicable disease, that they have to know how to clean their teeth and how to get the bacteria out of their mouths. And that's what the third our third installment is going to talk about. But if you establish this at a very young age, you establish a neural pattern, a neural network that will last a lifetime and save a small fortune in dentistry, time and money. And I'm sorry, nobody wants to go to the dentist and be drilled. It's universal.
Now, I just
Questions,
want to,
Howard?
yeah, I just want to be clear. You're saying that these fissures and pits are naturally in everybody's teeth? Is there something that we're doing when we're young that's creating them? Or is it just that's the way they are? Because when you look at teeth, they look perfectly smooth and shiny normally. Is this just natural or is this something that we create and we can prevent?
It's it's absolutely natural. It's non-preventable. It's the way that the tooth formed, and the technically the inside of the tooth grows away from this junction, and the enamel grows above it. And if it's a slope, it catches the bricklayers who can only go straight above at an angle. And everyone, it's universal. And when you thought I was such a good diagnostician when I was younger because I could always figure out which pits and fissures had decay in them. And then I started looking for the ones that didn't have decay, and I realized that they all have decay. They all have contamination. They all penetrate, all the holes and the cracks penetrate all the way into the hostess Twinkie, as I described, the 24-hour buffet, as I described, the inside of the tooth. And that inside of the tooth communicates directly with the blood vascular system. And so when you get bacteria in the holes, in the cracks in the holes, the pits and the fissures, that's a 24/7 whole life of bacterial contamination going into the blood vascular system.
Well, as I've said before, each tooth communicates with through a meridian system to every organ and every structure in our body. And if that tooth is unhealthy, it's going to cause potentially a medical problem elsewhere in your body. And you're not realizing that it's literally coming from your mouth.
Well,
Everybody.
this is an energy this is an energy issue that the acupuncture and Eastern medicine has looked at and understood for millennia, for thousands and thousands of years. And it hasn't caught on yet in dentistry, but there are people who can uh, evaluate whether or not a tooth is causing a problem. But just extracting the tooth or putting in a bridge or putting in an implant, no one's looked at that to see if it's any better than having the bacteria, so we don't really know for sure if we're even going in the right direction sometimes.
Well, typically dentistry is reactive. They wait, you go to a dentist when you're having a problem. You're not going to a dentist to prevent a problem. And it's biological dentistry today, as I guess we call alternative functional medicine dentistry, is hopefully going to take over one day, and more dentists are going to realize the importance of prevention and how to and what to do to prevent problems rather than wait until there's trouble. But trouble is what makes money, and a lot of dentists aren't interested in preventing; they're interested in making the dollars.
Howard, when I started clinically working on patients in 1970, all my first patients were relatives and friends. And so I went to the very best instructors because I knew I was going to have to take care of them for free for the rest of my life. And and I had built-in magnification. I had 2010 vision, and I didn't realize at the time, but I could see things that my peers couldn't. And and so the keys to really understanding dentistry have to do with magnification. Magnification gives you motor skills that you don't have normally, that you can't access. And and when you do these things and you understand them and you can magnify what you're doing, to get more control and understanding, you can make dentistry last 4 to 10 times as long. You have predictability. Predictability and longevity saves you a fortune in dentistry, in restorative dentistry, in making up for this. And the reason I stepped on this is I've been a holistic, functional, biologic um, uh, dentist from my first patient. Because if you care about your patients and their family and relatives, uh, um, I think that's one of the first questions every dental school should ask their applicants is, when you get out of dental school, are you going to work on your family and your friends? And if they say no, I don't want to do that, say, well, I think you should go into plumbing, because it still doesn't make you the best dentist. But if you don't have the confidence to learn and do the very best treatment, you have shortchanged your patients on longevity and durability and oral health.
Well, I want to thank you very much for being on the show, but people are going to have questions. So would you please give us your contact information? Say it slowly and say it twice because people have to write it down. I have guests that sometimes say it so fast, it's impossible. But I want them to be able to reach you if they do have questions. So slowly and twice, Doc, give us your contact info.
Okay, this is a cell phone, office cell phone and text. So if you call this number, you can leave a message or you can text this number, but it's area code 949-899-5530. 9 area code 949-899-5530. And thank you very much, Howard, for giving me this opportunity to hopefully help a lot of people understand what prevention in dentistry. It's not preventive dentistry. It's prevention of disease that damages teeth.
Thank you so much for being on the show. Everybody, if you have any questions for me, you're welcome to call my office in Manhattan at 212-581-0101. That's 212-581-0101. Oh, and please subscribe to the show and tell your friends about it. You'll see we've done quite a few shows now since I've gone back here on YouTube from my old podcast station. Um, uh, it's all about preventing and treating things in a safe and effective way. So everybody, please subscribe and tell your friends. Stay safe, stay healthy, stay well, and we'll be back again soon with another segment of Functional Medicine with Dr. Robbins. Bye now.